Hi class, and welcome to the Chapter 5 lecture on communications and documentation. After students complete this chapter and the related coursework, they will understand the importance of effective communication and documentation skills as they relate to quality emergency medical care. Different types of communication systems are explained, and the techniques and procedures for effective use of these systems are outlined. Students will also learn the purpose of the written report and the information that is necessary to make the report complete. Let's get into the introduction of our lesson. Communications are important during every phase of a call. The dispatcher must communicate the location and type of call to the designated responders. EMRs need to communicate with patients, bystanders, family members, dispatchers, and other members of the public safety community. Once you've completed a call, it is important to document the condition of the patient and the treatment given. Data and communication systems. The purpose of a communication system is to send information from one location to another when it is impossible to communicate face-to-face. The results of using a communication system will be only as accurate as the information that is put into the system. You must have a basic idea of how your department's communication systems works. Communication systems can be divided into two categories: those that transmit voice communications and those that transmit data. Voice systems. Voice communication systems transmit the spoken word from one location to another. Radio systems. You must understand the basics of a radio communication system and know how to properly operate the radio system used by your department. Radio communications are regulated by the Federal Communications Commission, also known as the FCC. Frequencies or channels are assigned according to the function of the organization. Several types of radios exist. Base station is a powerful stationary two-way radio that is located in a fixed place and attached to one or more fixed antennas. A mobile radio is a device that is mounted in a vehicle and draws electricity from the electrical system of the vehicle. Portable radios. They are a handheld, self-contained unit that includes a two-way radio with a battery, a built-in microphone, and a built-in antenna. Repeater is a device that receives a weak radio signal, strengthens that signal, and then automatically rebroadcasts it. The picture you see on this slide is a picture of a portable handheld radio. Telephone systems. Telephone systems primarily send voice communications. Landline systems are tied together through an above ground or below ground hardwired system. Mobile phones rely on radio waves between a mobile phone and a cellular tower to send and receive phone messages. Smartphones are used advanced operating systems, that combine the features of a cellular phone with those of a personal computer and global positioning systems, also known as GPS. Data systems. Communication systems are increasingly used to send and receive data. Data can be transmitted through radios, phones, or the internet. Paging systems can transmit text messages or voice communications. Mobile data terminals, also known as MDTs, transmit data messages through a radio system and are frequently incorporated into a mobile radio system. The figure on this slide shows a mobile data terminal, also known as an MDT, that can be used to display routing information transmitted from the dispatch center. Fax machines use phone lines or radio systems to send written data. Telemetry is used by advanced life support or ALS providers to transmit electrocardiograms, also known as ECGs, and other patient data to online medical control. Digital messaging is a technology that includes email, text messages, and social media, which are increasingly used by EMRs to send and receive information within public safety agencies. Let's talk about the functions of radio communications. Communication systems are used for different functions. Calls for medical assistance can be broken into 6 phases: dispatch, response to the scene, arrival at the scene, update responding EMS units, transferring the care of patient to other personnel, and post-run activities. Dispatch. Dispatch may use voice, text messaging, or an MDT to alert responders to an emergency. It's going to be your responsibility to keep your equipment ready to receive a call whenever you are on duty. If you are not sure that all information has been received correctly, ask the dispatcher to repeat it. Response to a scene. You need to know your response area. Learn how to use maps or global positioning system or GPS devices. The dispatcher may give you further information about the location of the call or the condition of the patient while you are en route to the scene. If you are unexpectedly delayed or encounter any problems en route, notify dispatch of the situation. This figure here, the picture that you have on your screen, okay, is an example of notifying your dispatcher if you encounter any problems while en route to the scene. Notice he's using a handheld radio. Arrival at the scene. You'll perform a visual survey of the scene as you arrive. You'll give the communications center a brief verbal description of the scene. Your report should verify the location of the incident, the type of the incident, any hazards present, the number of patients, and any additional assistance required. That's called a preliminary scene size-up. Update responding EMS units. You will be expected to update responding EMS units about the condition of your patient. Your report should include age and sex of the patient, the chief complaint, the level of responsiveness, the status of the airway, breathing, and circulation, and transfer of patient care to other EMS personnel. When EMTs or paramedics arrive on the scene, it is important for you to provide them with a handoff report. The easiest way to report your patient assessment results is to use the same systematic approach that you followed during patient assessment. You should provide the age and sex of the patient, describe the history of the incident, describe the patient's chief complaint, describe the patient's level of responsiveness, and describe how you found the patient. Report the status of the patient's vital signs, airway, breathing, and circulation. Describe the results of the physical examination. Report any pertinent medical conditions using the sample format. Report the interventions provided and the patient's response to them. Use the same systematic approach you follow during patient assessment to help ensure that you do not overlook any significant symptoms, signs, or injuries. Online medical control is generally used by EMTs and paramedics to secure permission to perform certain skills, get direction regarding patient care, or give patient care reports to the hospital. If your EMS system uses online medical control for EMRs, you will need to learn how and when to contact medical control. Post-run activities. After you've turned over the care of the patient to other EMS providers, you need to report your status to your communications center. Let the communications center know how long it will take you to get your unit ready for service and when you will be available for another call. Providing a written report of a call is covered under the section on documentation. This table up here is a set of guidelines for effective radio communications. It can be found in Chapter 5 in your textbook, Table 5-1. Let's talk about verbal communications. Effective communications means that the person receiving the message understands exactly what the person who sent the message meant. Effective communication requires feedback. The receiver needs to communicate to the sender that the message has been received and understood. Both external and internal distractions can negatively affect communication. Noise and the use of electronic devices constitute external distractions. Internal distractions, such as letting yourself think about a personal matter while on scene, can negatively affect your ability to communicate. Communication can also be affected when an EMR lacks empathy for a patient or shows prejudice against a certain type or group of people. Verbal communications with the patient, the family, and the rest of the healthcare team are an essential part of high-quality patient care. You must be able to determine what the patient needs and then explain this information to others. Now let's talk about guidelines for effective communications with patients. Your gestures, body movements, and attitude toward the patient are critically important in gaining the trust of both the patient and family. The following guidelines for communication will help you calm and reassure your patients. Introduce yourself by name and title. Ask the patient's name and use it. Make and keep eye contact. Use language that the patient can understand. Speak slowly and clearly. This figure here, the picture on the screen, shows how to introduce yourself by name and title. Tell the truth and allow time for the patient to respond. Limit the number of people talking with the patient. Be aware of your body language. Act and speak in a calm, confident manner. Make sure you respect the cultural norms of the patient. Use open-ended and closed-ended questions when appropriate. Treat all patients as if they were members of your family. Communicating with patients with special needs. Communicating with patients who are hearing impaired. A patient of any age may be unable to hear you for a variety of reasons. Could be because of hereditary deafness, long-term deafness caused by illness, ear infections, or injury, temporary deafness caused by explosion or other loud noise. Ask or write out the question, "Can you hear me?" After you determine that the patient is hearing impaired or deaf, do not continue to rely on verbal communication. When working with patients who are hard of hearing or deaf, use the following techniques. Identify yourself by showing the patient your patch or badge. Touch the patient. Okay, a patient who is hard of hearing or deaf needs human contact just as much as a hearing patient. Face the patient. When you speak so he or she can see your lips and facial expressions. Speak slowly and distinctly. Do not shout. Watch the patient's face for expressions of understanding or uncertainty. Repeat or rephrase your comments in clear, simple language. If all this fails, write down your questions and offer paper and a pencil to the patient to respond. Some people are both deaf and blind. Take your time, be patient, and use touch as a way of communication. Like all other parents in similar circumstances, deaf parents must give their consent for you to treat their child. Communicating with patients who are visually impaired. Look for signs that suggest the patient may be visually impaired. Tell the patient what is happening, identify noises, and describe the situation and surroundings, particularly if you move the patient. Learn the patient's name and use it throughout your examination and treatment, just as you would with a sighted patient. If the patient has a service dog, try to keep the patient and dog together. Visual impairment and hearing impairment are not related. It is not necessary to talk louder to a visually impaired patient. Communicating with non-English speaking patients, you may be able to adapt some of the techniques recommended for communicating with a patient who is hard of hearing or deaf. Supplement your questions with hand gestures, finger pointing, and facial expressions. Determine how much English the patient speaks, if any, and find out if a family member or a friend can function as an interpreter for you. Some communities offer language assistance services that EMRs can assess by telephone or through the agency dispatcher. Communicating with geriatric patients. When dealing with older patients who suffer from hearing or visual impairment, use the same communication skills you would with any other patient with similar conditions. Do not assume that all older patients have physical or mental impairments. Assess all patients carefully and give them time to respond to your questions. Communicating with pediatric patients. Caring for ill or injured children is a stress-producing situation for most EMS providers. Children and their parents or caregivers are often frightened and anxious. Familiar objects and faces can help calm a child. Talk to both the parents and the child as much as possible and tell them what is happening. Ask a parent to hold the child if the illness or injury permits. Tell the child your first name and explain what you are doing. Squat, kneel, or sit down to the child's level and establish eye contact. Be honest. The figure here I have on the screen shows an EMS provider squatting, kneeling, or sitting when treating a pediatric patient. Communicating with patients with a developmental disability. Ask the family or caregiver about the patient's typical level of communication. Speak slowly, using short sentences and simple words. You may need to repeat or rephrase statements several times until the patient understands what you want. You may be able to adapt many of the techniques that you use when treating children to your work with developmentally disabled patients. Persons displaying disruptive behavior. Disruptive behavior, can present a danger to you, the patient, and other persons at the scene and can cause delays in treatment. In managing any patient who is exhibiting disruptive behavior, take the following steps. Assess the situation. Try to determine the cause of the patient's disruptive behavior. Protect the patient and yourself. Stay between the patient and an exit whenever possible. Do not take your eyes off the patient and turn your back. If the patient has a weapon, stay clear and wait for law enforcement personnel, no matter how badly injured the patient seems to be. As soon as your personal safety is assured, provide the appropriate emergency care. Sometimes family members or friends of the disruptive patient may insist that you take the person to the hospital, but you cannot take a competent individual against his or her wishes. All right, let's talk a little bit about medical terminology. Medical terminology is a collection of technical terms used by medical personnel to identify anatomic parts of the body, specify illnesses and injuries, indicate treatments given. Medical terminology is intended to clarify language so that one person can communicate clearly to another the anatomic location of an injury, signs and symptoms of a disease, and treatments given. Your job as an EMR is to communicate your message to other medical providers as clearly as possible. Do not use medical terms if you are unsure of their meaning. As new terminology is introduced, look at the parts of each word. By learning commonly occurring prefixes and suffixes, you will gain some insight into new words. On slide 36 here, class, you'll see a table, which is table 5-2 in your textbook, which lists prefixes commonly used in medical terminology. Now let's get into documentation. Documentation is the second major type of communication that you will use in your daily work as an EMR. Documentation is a process for verifying your actions using written records or computer-based electronic records. By recording your actions, you provide a record for others and a document you can refer to in the future if necessary. Documentation provides a legal record of the actions you took. It also offers a basis to evaluate the quality of care given. Proper documentation includes the following: the age and sex of the patient, the history of the incident, the condition of the patient when found, the patient's description of the injury or illness, the patient's chief complaint, the patient's level of consciousness, the status of initial and subsequent vital signs, airway, breathing, and circulation, the results of the physical examination, pertinent medical conditions using the sample format, and the treatment you gave the patient while you were on scene and en route to the hospital. Any change in the patient's condition after treatment, the agency and personnel who took over treatment of the patient, the following times: the time you were dispatched, the time you arrived at the scene, the time other providers arrived on the scene, and the time you departed the scene. Complete your patient care report as soon as possible after each call. Your documentation should be clear, concise, and accurate. If you make a mistake, draw a line through it, initial the error, and correct it. Your organization may rely on patient care reports for documenting reportable events. Reportable events class includes certain crimes and infectious diseases, such as knife wounds, gunshot wounds, motor vehicle collisions, suspected child abuse, domestic violence, elder abuse, dog bites, and rape. It is important that you learn how the reporting process is handled in your agency and what you are required to do. Okay, class, let's summarize Chapter 5 on communications and documentation. Communications systems allow you to relay information from one location to another when it is impossible to communicate face-to-face. Excellent communication skills are crucial during every phase of a call. It is important for you to have a basic idea of how your department's communication system works. You must be familiar with two-way radio communications and have a working knowledge of mobile and handheld portable radios. You must know when to use them and which types of information you can transmit. Throughout the different phases of an EMS call, communication systems are used for different functions. The phases of an EMS call include dispatch, response to the scene, arrival at the scene, updating the responding EMS units, transferring care of the patient to other personnel, and post-run activities. The protocols for communicating with others during each phase of an EMS call vary from one system to another. It is important that you learn and follow the standard procedures and protocols used by your department. In addition to radio and oral communications, you must have excellent person-to-person communication skills. You should be able to effectively interact with the patient and any family members, friends, or bystanders. People who are sick or injured may not understand what you are doing or saying. For this reason, your body language and attitude are very important in gaining the trust of both the patient and the family. You must also take special care of individuals such as children, geriatric patients, patients who are hard of hearing or deaf, patients who are visually impaired, non-English speaking patients, patients with a developmental disability, and patients displaying disruptive behavior. Along with your radio report and oral report, you must complete a formal written handoff report that will be given to other EMS professionals at the scene. Documentation provides a legal record of the actions you took and offers a basis to evaluate the quality of care given. Remember that the call is not over until all the paperwork is completed. All right, class, let's do a little bit of a review here. Question number 1. When communicating with a sick or injured person, it is important to A. Use terms such as dear and buddy when addressing the patient. B. Only use medical terminology. C. Ask the patient as little as possible. Or D. Maintain eye contact with the patient when you can. If you chose D, you chose the correct answer. Maintain eye contact with the patient when you can. Question number 2. Which of the following would be considered good communication? You talk louder so you can be heard over the television. Or B, you initiate care without telling the patient what you are doing. Or C, you assess the patient while thinking about your last call. Or D, you minimize distractions during your conversation with the patient. If you chose D, you chose the correct answer. You minimize distractions during your conversation with the patient. Question number 3. When caring for a pediatric patient, you should consider A. Separating the child from the parents to avoid upsetting them. Or B. Speaking in an authoritative tone. C. Allowing the parent to hold the child if the situation permits it. Or D. Performing painful procedures without giving the child any warning. If you chose C, you chose the correct answer, allowing the parent to hold the child if the situation permits. Class, this concludes our lecture on Chapter 5, Communication and Documentation. If you have any questions regarding the material we covered in this lecture, please feel free to write the question down and bring it to class so we can share it with everybody in the class. Email me the question and I'll be more than happy to answer it. Or you can post it in Canvas, okay, under announcements, and we can answer it that way under the student forum. Thank you for your time. Hopefully you've got a little bit on how important documentation and communication is, and we'll see you at the next lecture. Thank you.